Gardner Audiology has been serving the Tampa Bay area for over 30 years. Here to explain more about what they offer patients is Dr. Jody Contier. Good morning. Good to see you.
Nice to see you.
So we've talked a lot about kind of the different effects of hearing loss, right? And maybe the different treatment options and stuff. But I love what we're doing today because we're kind of explaining who you and your partners are as a team and why this is so needed, I think, in the Bay Area as well. So kind of take us back to the beginning. You guys have been, and I don't mean to do this to age you at all, but you've been around for a while, which I think is awesome.
Dan Gardner founded the business in '82 and I joined in '85. And it was the two of us for many years, and we have grown. We now have 7 locations. We have 4 full-time board-certified doctors of audiology providing patient care. A lot of us, we use audiology assistants to provide patient care.
I'd imagine the world of audiology has changed just with the, advance of technologies. I can imagine where you've seen this office and the team and everything grow tremendously.
In more than 30, I'm going on my 33rd year as an audiologist, and the technology changes have been phenomenal. From hearing aids that we used little screwdrivers to make minimal adjustments to everything being computer programmable, and hearing aids that connect with your iPhone, and just all different kinds of really cool technology that is so much better than what we had before. So lots of improvement.
What's interesting too is depending on the office that you go to, certainly the team or the experts that you go to, maybe the technology is somewhat the same, but I think there is a difference between you and your team about the service that you provide as well. Talk a little bit about that and why that's important when it comes to this field.
Well, your hearing aids are only as good as the person programming them, because if you don't know what you're doing with the computer, you are not going to successfully fit someone. There are so many different variables that affect what a hearing aid does in someone's ear that you cannot just do a best fit or a target and assume that it's correct for the patient. So, we do employ only doctors of audiology.
Which there is a big difference from what I understand.
8 years of education as opposed to, 6 months training and pass a state test. So it's a big, big difference. And when you're, especially with the diagnosis of the hearing loss, that is just critical, because you really need to find out what is going on with the hearing and not just will a hearing aid. That's an after effect. Yes, if you have hearing loss, perhaps it will lead to a hearing aid, but not all hearing loss is going to be treated with a hearing aid, and it's very important to find out what's going on.
Now, I know a lot of people don't maybe want to bring this up right off the bat, but let's talk about cost. And what I think is interesting with you and your team, too, is you take most insurance companies. I mean, that could be something that keeps people from not calling or not getting help.
Well, we are providers for most insurance companies. We are Medicare providers. A lot of insurances do not cover hearing aids, and it is an unfortunate thing, and it is something that is not going to change anytime soon.
You don't think so?
Because there's a lot of money going to be involved in that change. But fortunately, we are able to offer solutions from very low cost to the very, top of the line as well. So we try to find something for every budget. We can also sometimes refer to certain agencies if someone is working and needs hearing aids. There's vocational rehabilitation may be able to help them, stay employed by helping them obtain hearing aids. We do a lot of work with the Starkey Hearing Foundation. We volunteer our services to fit hearing aids that are provided by them to people who cannot afford hearing aids. So, there's a number of options, and it's our job to listen to the patient and find the best solution for them. We are a very patient-centered practice, and it is not just in and out, and you're not a number. We really want to find out what's going on with each individual.
Well, you can tell this is your passion. You can tell why you've been in this business for more than 30 years, and you get enjoyment out of literally changing people's lives and enhancing their lives. As we wrap up here again, how many locations throughout the Bay Area?
We have 7 locations.
7 locations. All right. Well, Doctor, so good to see you again.
Nice
we appreciate your time on our show as always. And again, there's the info to get more additional information as well. But we look forward to seeing you again soon.
Thank you.